Firstly, how significant of a threat does the variant pose to public health in the UK?
So it's probably the most significant threat we've had since the start of the pandemic. And I'm sure, for example, that the numbers that we see on data over the next few days will be quite staggering compared to the rate of growth that we've seen in cases for previous variants. The real potential risk here, and I would underline that because we are still learning a lot about the variant, is in relation to its severity, clinical severity, and therefore whether those cases turn into severe disease, hospitalisations and deaths. And we are still at too early a stage for that. In fact, the world probably is still at too early a stage to be clear. The difficulty is that the growth of this virus, so it has a doubling time, doubling days at the moment, which is shortening, i.e. it's doubling faster, growing faster, and in most regions in the UK is now under 2 days. When it started, we were estimating about 4 or 5. So if you think of that growth rate right across the UK, and we're starting to see it and feel it now, in London particularly, but yesterday particularly around Manchester, and we're very sure there are levels growing across most communities in the UK now, although there is quite a lot of regional variation still. The real risk issue is that we can see that there are so many unusual mutations on this virus that it runs the risk of evading our natural and/or vaccine immunity. And we have early studies looking at immune serum from patients who've been ill and been vaccinated to see that 2 doses of vaccine against symptomatic infection, so we don't know yet about severe disease, but about symptomatic infection is much reduced. We do know that the booster dose will push that right back up, but it still comes back to a level below that we've had with the booster effect for Delta, our previous wave. And so this is highly significant because the numbers of individuals who are potentially involved with this and a small degree of vaccine or immune evasion could have very significant impact on our health services.
Order, order.
The ayes to the right, 369. The noes to the left, 126. Wow.
Thank you. The ayes to the right, 369. The noes to the left, 126. So the ayes have it, the ayes have it. Unlock. Minister to move the motion relating to the Draft Health and Social Care Act 2008 Regulated Activities Amendment Coronavirus No. 2 Regulations 2021 formally.
There is a new variant of COVID-19, Omicron, which is highly infectious and spreading fast. Every adult in the country needs to get a COVID-19 booster vaccine. Boosters give you the best possible protection against the virus and should significantly reduce your risk of serious illness and hospitalisation. Get your COVID-19 booster vaccine to strengthen your protection. Please get boosted now.
Order, order.
The ayes to the right, 369. The noes to the left, 126. Wow.
Thank you. The ayes to the right, 369. The noes to the left, 126. So the ayes have it, the ayes have it. Unlock. Minister to move the motion relating to the Draft Health and Social Care Act 2008 Regulated Activities Amendment Coronavirus No. 2 Regulations 2021 formally.
I beg to move.
The question is as on the order paper. As many as are of that opinion say aye.
Aye.
The contrary, no. Division, clear the lobby. Order. Order.
The ayes to the right, 441. The noes to the left, 41.
The ayes to the right, 441. The noes to the left, 41. So the ayes have it, unlock. Minister to move the motion relating to statutory instrument number 1415 formally.
I beg to move.
The question is the motion relating to statutory instrument number 1415 as on the order paper. As many as are of that opinion say aye.
Aye.
The contrary, no. I think the ayes have it. The ayes have it. Minister to move the motion relating to SI number 1416 formally.
I beg to move.
The question is the motion relating to statutory instrument number 1416 as on the order paper. As many as are of that opinion say aye.
Aye.
Of the contrary, no. Division, clear the lobby.
Just that. Madam Deputy Speaker, I just said a moment earlier that we won't keep measures in place for a moment longer than we need to. And for example, now that there is community transmission of Omicron in the UK, and Omicron has spread so widely across the world, the travel red list is now less effective in slowing the incursion of Omicron from abroad. So I can announce today that whilst we'll maintain our temporary testing measures for international travel, we will be removing all 11 countries from the travel red list effective from 4 a.m. tomorrow morning.
Well, it's quite clear, all the evidence is that the booster jab gives you additional protection, almost 75% additional protection against this Omicron variant. So it's really important for all of us to get the booster jab. I've had it, my wife's had it, my kids are booked to have it, my mum's had it. Why? Because it's the game changer and potentially the lifesaver. So we've got to be patient. The queues are a good thing because it shows demand is up, queues for the booster jab, but also there's a better delay getting lateral flow tests and PCRs. That's a good thing because people are applying for lateral flow tests and using them before you go out and about shopping or socialising or going to the office. If you have to go to the office, do a lateral flow test to make sure you're not carrying the virus, but also make sure you do the booster jab. We've been working with sporting venues, nighttime venues, pharmacies, GPs, the NHS, to make sure there are more and more places to have the booster jab. There are more than 400 places now across London to have the booster jab. You can go to the NHS website, type in your postcode, or you can go to my social media to see how to get details of your nearest booster jab. Please be patient and get it because it can make a real difference. Well, I think what's important is for us to make sure we support businesses, enjoy Christmas, but do it safely. That's what I'm asking the government to do, is because we've seen a collapse in business for some of our hospitality over the last week, 40% drop. The government needs to provide financial support to businesses. I'm asking the government to do two very simple things. To give grants, so councils can pass the grants on to the businesses, but secondly to give 100% business rates relief to businesses, particularly in hospitality, retail and culture. Why? Because if we're not careful, these businesses will go bust and people lose their jobs. That's why it's so important, as the government's introduced COVID passports, which I support, as the government's ramping out booster jab, which I support, we also provide financial support to businesses that need it this time of year. I've seen that Londoners, by and large, and those across the country do the right thing. they feel let down by the Prime Minister and those in Downing Street, what they did last year, we're going to carry on doing the right thing and following the rules, and I'd encourage everyone to follow the rules.